So I want to talk a little bit about, just kind of, and I know it's different for everybody, but when you get a new client, the patient that comes in with Parkinson's, they have a diagnosis, you're seeing them for the first time. What are kind of your basic beginning steps to getting them started with treatment?
Sure. Yeah. So usually I have a medical history and referral from their doctor, or I ask for it if they're self-referred. And so I have that to review. And then I do my interview, a motivational interview, because some people come in, Parkinson's disease also affects the sensory system. So sometimes they don't really realize they're no longer intelligible, or they're coughing or whatever it is. And it's their loved ones who say, you need to get help. So either way, we kind of figure that out. What is their long-term goal? Some people say, I no longer go to choir, or I lose my voice on the phone, or I can't talk at the dinner table anymore. And that's my long-term goal right off the bat. For most people, I use the Speak Out protocol for assessments just because it gives me a lot of really good information. And if they're going to do it, then I've got that information. It gives us decibel level baselines in various speaking contexts. And I also do some acoustic analysis. So I will take some recordings and run them through Pratt and get their CPP level, which is their kind of dysphonia level, their vocal range, things like that. Have them read some reading passages. And then I will describe their voice. What are the vocal qualities what severity do they have with those? I might do the CAPE V, which is a way to describe the voice. And then we'll do stimulability, which is if they're going to do Speak Out, I will teach them how to use intent, have them model, have them repeat, and see if they're a good candidate, see if they do pick up, the skills and improve their decibel levels.
Wow. So it's very thorough.
Yeah.
This is not messed around. This is like, we are going to look at the whole picture. And you touched on something that I was curious about. It sounds like not everybody is an ideal candidate. It's not like everybody who's got a diagnosis of Parkinson's disease, who's not the best candidate for this program?
Sure. Well, first, you've got people who don't want an intensive program. Maybe they're like, I go to physical therapy, I go to this appointment, I'm too busy, it's 3 times a week. If it's LSBT, it's 4 times a week.
Wow.
And so they're just not ready for that. And I may do something else. Or they're mild in their progression and they don't need the intensity, or they say, I could do that, but let's wait. And so I have them do some other things. Or they have something that needs to be worked on first. So maybe to compensate for their breathiness and their weakness, they're clenching and have some muscle tension. So we need to relieve that first. And then we can do Speak Out. Because if you have muscle tension and then you start yelling, it's going to make it worse. So there's things like that.
And so do you gauge their almost like, this is going to be work on your part. It's going to require your cooperation. And if somebody says, I'm not really, does that kind of also take them where okay, this maybe not forever, but right now this is not the right time. Do you require that buy-in on their part to say, I am going to commit to doing what I need to do in order for them to be in the program?
I do try really hard on day one, even the assessment day, to be like, this is what it is. There's a daily practice. And I'm going to start incorporating a visual analog scale like they do in Forte, which is the phonation resistance exercise training for presbyphonia. I really like that because they can mark how ready they think they are for therapy. And that's a really great way to talk about it, as opposed to them just going, yeah, sure, I can do that because I'm being so convincing. I do try really hard to educate on that, and that education continues throughout the course of treatment. If people are slipping up with their homework, yeah.
Yeah, because I think sometimes people think, oh, the right answer is I'm going to tell you, no, I absolutely want to do this. And it's like, no, we don't want that answer. If that's not, don't tell me you're going to do it and then not. There's no wrong answer. But I think with any of the diagnoses we work with, where we know it's going to be an ongoing, it's like if you, and again, that may change at any time throughout, but I think that's so important to get that, especially it sounds like for this type of program where it really will require a commitment.
It really does. And I think with LSVT and Speak Out both, they get progressively more difficult. So there's a workbook and it starts out easy and it gets hard. So if you're not doing the daily homework, you won't be able to keep up. And I have that talk a lot because a lot of people, it's difficult to integrate that into their life. So it's important to brainstorm ways to complete it. But we're always adapting. If they're finding it challenging, we talk about why and we try and see how we can fit it into their daily life or stop the program and pick it up later or whatever it is.